Okay, so now we're gonna go ahead and treat him with laser. So we just did Graston technique to break up some of the muscle adhesions. We are now going to laser his tennis elbow or lateral epicondylitis. It's basically the same thing. Doctors really like to give all sorts of fancy names to conditions. It makes us feel important. No, I'm kidding, it doesn't. But lateral epicondyle right here, you also have the medial epicondyle on the inside of the elbow. If you have elbow pain on the inside, the same thing can be done on the inside, and same thing with laser treatment, but that's called golfer's elbow or medial epicondylitis, okay? So after we laser him, we do the Graston technique, I'm then going to adjust his elbow. So there are a number of things that we do here that are pretty unique in the sense that a treatment of lateral epicondylitis, one being the adjustment. Most chiropractors do not adjust shoulders, elbows, wrists, things like that. So we do that here. And then the laser therapy is another unique treatment that we do here for tennis elbow. So what I'm doing is I'm lasering right over this spot that was really tender for him, which is the origin of pronator muscle for a tennis elbow. So, and then it inserts lower down into the hand. And you have fibers that insert into the forearm as well. Now this laser I can check for areas of inflammation, soft tissue damage. We're not gonna do that, I already know where those areas are. Okay, and we're gonna go ahead and do a little scan right now so I can show you guys how that works. We wanna start in an area away from the injury, towards the injury, right over the epicondyle, and there you go, it beeped. So that tells us there's some soft tissue damage there, and it's gonna tell us for how long to dose the area with laser treatment. Anything over 2 minutes is considered a long time, so that would tell me there's a lot of inflammation in that spot if this treats for over 2 minutes. Let's see what we get here. So right now I have it set at 1,000 hertz, and 1,000 hertz helps reduce inflammation, reduce muscle spasms, and pain as well. And then after a couple of treatments, we go deeper with the laser and change the frequencies to lower numbers. The lower the number, the deeper the laser penetrates. So there you go, it was a little bit less, it was almost a minute, not quite. Go ahead and scan up the arm here. Probably get another beep around here somewhere. Now, for those of you wondering, you know, lateral epicondylitis or tennis elbow, I've done some videos on stretches and exercises for lateral epicondylitis, tennis elbow. Make sure you check that video out. And we've also done some other treatment videos of lateral epicondylitis. We'll see how long it doses this area for. Again, anything over 2 minutes tells me it's really inflamed or there's some soft tissue damage. There's some significant soft tissue damage. You don't feel this at all, do you?
No,
yeah.
nothing at all.
And that's the beauty of cold laser therapy. You don't feel anything. It's safe, it's effective, extremely effective, and most of all safe. There's no side effects to it, unless you're on some medication that makes you sensitive to sunlight.
Coldness actually feels a little good.
It feels good, yeah. So he says he feels a little bit of cold. Some people feel that. Not everybody. Most people don't feel anything. Some people feel a little bit of tingling. We're just gonna scan over the rest of the muscle and tendon. Yeah, so it's beeping along that whole tendon and muscle here so far, along the whole pathway of it from the insertion all the way to the belly. So we have an origin and an insertion. So it beeped again. That was pretty quick. So that tells me there's not a ton of inflammation there and soft tissue damage. So the origin, each muscle has an origin and an insertion. So it originates at one point and then it inserts into another point. The belly of the muscle is the center of the muscle, which is right about here where we are. And let's see how long this dose is for. My guess is it won't be much more than a minute, if that. So when we laser, we want to laser both at the origin insertion at the belly of the muscle, especially if there's inflammation. I would say the most important, if you had to pick, would be the belly of the muscle. Okay, going on 30 seconds here. And then we're going to check your elbow to see if it needs to be adjusted. Okay, so I checked his elbow before. He tested weak on radial head test, so we're gonna just double check that again. There we go. Okay. So we go through a series of tests for the shoulder, elbow, arm, and 1, 2, 3, resist. Good. And 1, 2, 3, resist. Okay, so there I'm checking the long head of the biceps and the bicipital tendon. Any pain there when I do that?
No.
Okay, great. And when I did this, I was checking the tricep, okay? And now we're checking the tricep, but we're also checking the head of the ulnar bone in here. And 1, 2, 3, resist. And normally that would be weak, oftentimes with somebody with golfer's elbow. So we're checking the ulnar bone, which is on the inside of the elbow, over here on this side, you guys can't see. And again, typical with golfer's elbow. He has tennis elbow. So now we're gonna check the lateral head here of the radius and make sure it's in place. And it was weak before, and 1, 2, 3, resist. Yeah, see, feel how it kind of gave weak right there? And so we're gonna go ahead and adjust his, the radial head. And I know from that test that the radius has gone posterior and lateral. Okay, and just relax yourself here. Do you hear that?
Yeah.
I don't know if you guys heard that, but you heard the radial head go crack, snap back into place. Now we're gonna test it again, and 1, 2, 3, resist. Better. Okay. You're all set. Go home, take it easy. No weightlifting with the arms. Try to stay off of it. I know. Just for a couple days. All right? Thanks for tuning in. If you guys have any questions about lateral epicondylitis, medial epicondylitis, tennis elbow, golfer's elbow, comment below. Maybe we'll do another video on that. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.